All right, you guys, Ralph Havens here from Beyond Limits Physical Therapy in Bellingham, Washington. I almost said San Diego. And Tom Giammatteo, physical therapist, chiropractor, naturopath, and co-developer of Integrative Manual Therapy. And Dr. Tom, thank you for being here. We do these twice a month, these podcasts, and we're going to put a whole playlist together of all the podcasts over these years that we've been doing them about integrative manual therapy. And I'm going to talk a little bit about of it, my experience of it, and then get right into this with Dr. Tom about ambulation. So runners, walkers, balance, what's going on in the world right now, and helping people with walking. And so years ago, I was taking lots of classes in physical therapy and osteopathic techniques and other techniques. And then I met Sharon and Tom and in my first class in San Diego. And what happened was quite interesting. I'm already a runner, but I did these techniques that were very, very light touch, new techniques. I was already used to doing very specialized hands-on techniques, but I was doing these new techniques. And that week, my running was incredible. My pelvis was more open. I was light. I felt faster. And it's been consistent. Whenever I take a class from Dr. Tom or do some of this work, I just want to go run. And so I want to open it up to Dr. Tom and just talk about this whole integrative manual therapy and how is it different from other therapies? And, you know, the myofascial mapping to find the root cause of things is so important. And if he wants to talk about tuning forks, there's a whole thing about how things move. And so, Dr. Tom, thanks for being here. And what are your thoughts on anything IMT related and walking and ambulation, running, that sort of thing? It was a great conference this last couple weeks ago.
So winter school was ambulation and gait into new consciousness. And we really looked at going back through the old material since 1990 through all the way today. And we called it the ambulation class. And, we have our hips and there's a ball and socket. And the most common injury to that is called a total hip replacement. And we're looking at the arthritis, the hip, and they're now doing them as early as 45 years old in people. So when your hip gets arthritis in it, the Western medicine says, well, let's just take the bone out, put a cup and metal ball into it, and we have a nice new total hip. It's good for 10 to 15 years, and then it blows up, and we may be able to put another one and to do those things. So, in the structural medicine world of integrative manual therapy, we are always looking at from when the foot hits the ground to the toe off and the space in between that whole spot process. And from the right big toe to the left big toe is all one circle of chains. And if you change 1 degree of movement in the little toe or something else, it can influence the rest of the body. And most people are having pain in what we call the hypermobile joint, the one that moves the most, the one that can't be repaired. And, you learned this trick really early with us. We go look at all the bones from all the foot all the way up through the sacrum and back down the other side to figure out why that knee hurts, or why does that ankle hurt, or why does that hip hurt in that whole process. The other thing that happens is the hip makes a ball and socket joint. And besides creating arthritis and the hip eating away at things, there's actually another form of disease that happens about 2% of the population, that the hip goes through the pelvis and goes into the abdominal cavity, which is called protrusio acetabuli, and that's getting more and more prevalent. And
Isn't that weird? It's getting more prevalent.
Right. Well, we've heard of osteoporosis, so the bone doesn't form as well. And with bad diets, we're eating junk and it's corroding our gut, and that can actually wear away on the top of the hip and it protrudes there. So, you changed your diet, you felt better. We worked on your sacrum and your legs, and you run. I actually have a group of 10 to 20 runners that come in before they go for long distance races 2 or 3 days before, and they have improvements of 10 to 15 minutes on some of their times.
Yeah, I work on Ben 3 or 4 or 5 times a week because he's right there. And he always asks me, can you work on me, Papa? Because it's like he gets a more wide open stride and
Right.
got him on a good
So,
diet. Yeah.
yeah. But the whole course was taking our sacrum compressions and our low back pains and putting it together into skate and ambulation. And we're actually just, this big curly spiral thing that we have these figure eights that are playing in the body. And the ambulation course took 100 new systems and put them together. And, we're changing people's heart condition. We work on the heart, but the hips open up at the same time. Because
Yeah. Yeah.
we're influencing the balance. And tomorrow, this is just the public service announcement. If this is March 19, 2025, spring equinox is coming tomorrow around midnight your time and about 3 o'clock in the morning our time. And that for older people can actually make them, the symptoms of tripping and falling and not losing the balance because the earth is shifting and our vestibular systems are not used to it along the way.
Isn't
So
that funny?
we're going to receive 12 hours of daylight and 12 hours of sun darkness tomorrow, and that can also be influencing your vestibular mechanism, which goes down and influences your process. So those are two interesting processes that we will have done, and between this year and next year will be my 30th wedding anniversary to Sharon, 1996 to now. And her passing was 10 years ago. So we're in a celebration mode. The Connecticut school is teaching a lot. I'm on the speaker bureau this year again for the American Massage Therapy Association, the Physical Therapy Association, and the Chiropractic Associations. So the word is getting out there about IMT again, and we're sort of waking up into this new world.
It's so awesome. Yeah. And it is amazing how something as far away from the legs, like the heart, can affect the running. It's that was my first experience with IMT. Was I couldn't run. I actually made a video today about it. I got to put on the internet, but yeah, the calf spasm that wasn't helping, wasn't fixing up for 8 months, all sorts of treatment, orthotics, and then 1 2-hour IMT session to the heart. And then I went for a run 2 days later and it was good.
Yeah, and a case study of the week is we have a woman that just finished, she had an aortic aneurysm, and that's the main blood pipe to the body. And so she had a bulge in it, and if they blow up, you lose all your blood, you bleed to death. So she had a surgically repaired just below her diaphragm, so in her abdominal area. And she came in, it's about 6 weeks post-op. And this is only our second hour with her, and she came in when I wasn't in the office the first time. And they had to take the arterial system and put a band around it to contain this bulge, right? And that sort of put her into arterial spasm, which would be our red book that nobody knows about around autonomic stress and strain. And so as we're treating her, I'm waking up now. I'm waking up. I could feel the blood supply go back and forth. And as she was complaining about things, she goes, well, my toe fungus is getting worse on my foot. And as I went down to look at the toe, she had a surgical scar from a fractured ankle when she was 25. So we worked on seeing that. It seemed like the surgery of the aneurysm also stood up this old history, and the infections were coming out her toes. So all
Wow.
of this is connected. Your past history has influenced what you do today, and most Western philosophies don't really take that into consideration.
Yeah. And one of the things that I found in my first IMT days was I had taken all these different like osteopathic techniques, the visceral manipulation and the up ledger cranial sacral stuff and mechanical link. And I felt like I had a good handle on stuff, but it was so all over the place. And with IMT, there was the myofascial mapping so that we could map the body and find out, well, where is the primary problem, this cause, and then go do stuff to that instead of like being all over the place chasing like toe fungus or heart
Right.
problems or hip problems. because it could
Yeah,
be,
it gives you a direction of where to go and how to go.
it really
with
is
the
cool.
process.
I worked on Jen this last week because she had a snowboarding injury, and it was she gets so busy, doesn't let me work on her very much, but her shoulder was still pretty tight. And what I found was some disruptions around the inferior vena cava, superior vena cava, that area. Worked on that, and I knew it was going to be better because when I did my mapping, she was mapping all over the body, different areas. But when I touched that area, everything else looked good. So I thought, oh, all roads lead to this. And we did this, and then she got significantly better. And that's the beauty of IMT. One of the many things is this myofascial mapping, because if you're in the right place, you've got a chance, you know?
And everything else changes up and down the chains. So,
Yeah,
and especially if you've gone and they say, well, my shoulder hurts and it still hurts, and you're at the surgeon now because everybody else has given up on improving the process,
yeah,
IMT should be looked at. And the other things that have happened is, we will also look at nature's influence on mankind. So we're having we had the full moon, we had a eclipse, we're having the summer solstice now, Mercury's in retrograde, and all those create worry, depression, and suicidal ideation that Western medicine just says, oh, you're just crazy type of
or
thing.
it's
So
like a different practitioner, like go see this specialist about that part of the problem, and go see this
right.
specialist. And we're not against doctors. Doctors are very important, and this doesn't go against any other medical treatment. Like I know somebody that has a significant diagnosis right now with a bone problem, a young kid, and the doctors have certain surgical options that they're presenting and all sorts of stuff. And I'm thinking, man, it'd be so cool to be able to like continue to work with this person, even though the medical system is also on board. It's like it doesn't mean you have to be one or the other. Like you can use this with. It's cool to
Right.
do with other practitioners as well. People get to see what.
Yeah, most of my clients that have some chronic pain, they're going to a pain center or a chiropractor weekly or a massage therapist weekly.
Yeah,
And I tell them that my goal is to be able to have you live life double without needing those people. So
yeah,
if you
and it's
don't
okay
have,
to use them while you need them. But yeah,
right,
the goal is to get you healthy so you can go do what you're here to do. And that's one of the things that I noticed with running. When I get IMT done on myself or spend a little time doing it to myself, take a class from you, I just want to go run. Like my body just feels so good. So, well, good
yeah,
deal, Tom. So I'm gonna get a playlist of all these podcasts that we've done all these years and put it in the description wherever you find this, and then reach out to Tom. I'll put an email to Julie's address too, because he has every week for practitioners, you can come in and learn from Dr. Tom a 2-hour Zoom class every week. And then, and like I said, then we'll put the podcast up there, and we're going to be doing, Tom's going to be doing a 10-year celebration thing for Sharon Giammatteo and
probably in September.
in September. So get on Tom's list, imtwellnesscenter.com. I'll put the links and everything below. And if you're a practitioner or you're seeing practitioners, reach out to us and we can hook you up with Dr. Tom. So ralphhavens.com on the West Coast and imtwellnesscenter.com with Dr. Tom in West Hartford, Connecticut. And I guess that's it, Tom. Anything else to say?
No,
Maybe to the IMTers. There's a lot of IMTers that have been in your world and they're coming back. And anything to say to the practitioners of the world?
just come in the door. We'll treat you like family again.
It is that, man. It is that. Okay, well, that's perfect. All right, well, I'm going to click everything off here. And let's see.